Let's talk about one of the big reason that we are seeing so much volatility on the street, and that, of course, is the recent development when it comes to the coronavirus. So the number of cases continuing to climb worldwide. As it stands right now, there are well over 220,000 cases, confirmed cases across the globe. And it's interesting when we start putting this in perspective and break it down by country. We've been talking about the staggering number of cases out of China over the last couple of weeks, but it actually looks like that has now leveled off. The total number of deaths in Europe has now surpassed the number that we have gotten out of China. I first want to go to Anjalee Khemlani, our Yahoo Finance reporter that has been closely tracking these developments. And Anjalee, what is the latest just in terms of the number of cases that we are seeing outside China and what that could mean for us here in the US?
Absolutely. Well, we know for a long time they've been warning about what's been happening in Italy specifically. We're seeing that the number of deaths is now more than 3,400. Meanwhile, if you compare that to China, which only saw 3,200 deaths by comparison, so not much of a difference there. And if you look at the cases, we're even beyond 220,000, which is what we started off the day with. We're now at 2,300, 230,000. And that number is actually interesting when you also compare China, Italy, because China has about 81,000 of those cases. Meanwhile, Italy has 41,000. So really, when you do that comparison, you're looking at China and Italy really taking the lead in really seeing the impacts of this virus outbreak. We do know that a lot of this is contributed to Italy's elderly population. It has a median age of 47 years old. Meanwhile, China's is 37. Aside from Japan, Italy really has one of the largest older populations in the industrialized world. So we're looking at that as really an indicator of what it is that we need to be expecting, what it is. We've heard the stories really about what's been going on in the healthcare system as well, and how overburdened it is right now in Italy, and what that could mean for the US if we don't in fact get the testing done to get that clear picture, which is what the country is focused on right now. So really, as we're looking to the rest of the week and early next week to get that clarity and understand where the demand is, we know that the three major states being hit right now are Washington, California, New York, and that will likely continue in the next week.
For more on this, I want to bring in Dr. Tsai, a Harvard health policy researcher and a surgeon. And Dr. Tsai, we just heard Anjalee talking about the fact that there have been no new cases reported for the first time coming out of China. And when we talk about how this could relate here to the US, what we're seeing right now, obviously we are a couple of weeks, if not a couple of months behind what we saw in China in terms of flattening the curve and the fact that we don't see a growing number of cases out of China, at least at this point. What do you think that means for us here in the US?
I think the lessons from China is that massive public health response can work. They've engaged in very severe quarantine. So I'm not saying that that's what's needed in the United States now, but it does show that with effective and concerted government and social response, we can help break the chain of transmission from spreading further. So in some ways, it's encouraging that China doesn't have any new cases. It's discouraging that it's taken that dramatic and drastic of quarantine measures in Hubei province to get to this point. But I think there's a lot of lessons to be learned one way or the other.
Dr. Tsai, we heard from the vice president today talking about companies like Honeywell and 3M ramping up on manufacturing of masks amid all the shortages we're seeing nationally. And yet we're hearing some of these stories out of the hospitals talking about reusing masks that have already been used because they just don't have the supplies in place. Can you talk about the capacity concerns that you are hearing about right now?
Yes, I think on the front lines, there's a very real concern in terms of getting the personal protective equipment, the masks, the N95 respirators to the frontline clinicians. There are stories of clinicians and nurses going to a Home Depot or Lowe's to purchase their own N95s. Construction companies are delivering and donating supplies to the hospitals. And I think that outpouring from other parts of the society is helpful and important, but actually illustrates the critical gap between what's needed in the front lines today versus what increased production can bring, weeks or months down the road. So I think the key thing is we need to focus on how do we get the equipment to the clinicians and nurses who need it right now. It's important to plan for the next weeks to months, but I don't want to mortgage our present to guarantee that we have future supplies.
How effective would you say that the response has been from government officials so far, and also the Americans trying to abide by what they're suggesting that we do in terms of, for example, New York? There's a disagreement between Governor Cuomo and Mayor Bill de Blasio if all New Yorkers should be forced to shelter in place. So do you think the measures being taken so far are helping?
I think the measures are definitely helping, but everybody's working in a rapidly evolving situation, and nobody, the clinicians, the policymakers, politicians, government leaders, hospital leaders, nobody has the benefit of hindsight at this point. So I think everybody is working with the best information they can, and balancing the importance of flattening the curve, decreasing the risk of transmissions, increasing social distancing, good hand hygiene, with also the real consequences of social isolation that can happen from a very severe quarantine. It's not insignificant to pull children out of school. It's important now. I think the best data right now is because of the lag in laboratory testing, we've been flying blind for the last several weeks. We're continuing to be flying blind. So instead of being able to treat and quarantine isolated clusters, we have to resort to society-wide measures of staying at home and social distancing. Unfortunately, it's the best that we have right now.
Dr. Tsai, I just want to get your thoughts in terms of what we heard from President Trump today. Now, he was talking about, he was putting the pressure on a lot of these companies. He wants to see a rush in terms of when we get a vaccine, the timeline of that, also just for a potential treatment. From your experience, is that smart, or do the risks outweigh some of the benefits that we could see?
I think it's smart to, I wouldn't say to use pressure, but I think it's a massive mobilization. Clinically, we're doing that in the hospitals to mobilize our clinician workforce. We're mobilizing bed capacity by decreasing elective surgery. And on the manufacturing side, I think that's happening as well. It's mobilizing the private sector in the US to manufacture and ramp up production of the needed PPEs to equip our healthcare workers. So I think this is not an everyday cold and everyday influenza. This is a generational pandemic. So I think we need that, wide scale social mobilization, but we need everybody working together. So you need the government officials to break through the red tape, which is starting to happen. And you need that in order to set the stage for manufacturing, for hospitals, and for clinicians, and for every individuals to be able to step up and be able to break this chain of transmission.
All right, Dr. Tsai, thanks so much for taking the time to join us today.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.